a Medicare supplement, say you're turning 65 and you have cancer, Parkinson's, COPD, you're taking insulin, you got some major chronic health conditions. When you buy that Medicare supplement, the first time you go on Part B, they can't ask you any questions. No company in the nation can ask you anything. You're guaranteed to get any plan, regardless of your health. Then you're saying, okay, but what happens in the future? Well, that's very much contingent upon what state you live in. So let's look at the map here. If you are living in one of the states in red, they have special state laws that are more lenient than federal laws. So the federal law says you could always change your Medicare supplement at any time, as long as you can answer those health questions, which in most states, all the blue states, like I said, if you have Parkinson's, insulin-dependent diabetes, COPD, cancer, big stuff, they're not going to allow you to switch. You're not going to be able to pass the health questions. But if you live in one of these red states, they have state laws that allow you to switch under different circumstances. So there's 4 states you can switch at any time of the year for any reason, such as New York, also Washington State, Maine, and Vermont. They have year-round open enrollment. You can just change whatever you want. As you can imagine, because they can't charge the sick people more, everybody pays more. So New York is going to pay double the rate, maybe more than double, of anybody in a blue state. So the good news is if you're sick, you can move around. The bad news is if you're healthy, you're really heavily subsidizing the sick people if you're in one of those states. Now, if you're in the rest of these states, except for Missouri, these are all birthday states, which means you can switch your Medicare supplement. Generally, it's 30 days before your birthday and 30 days after. So they give you that little window. And so everybody's is different based on your birthday, and you can switch your Medicare supplement to a similar or lesser plan. So if you have a G, you can move to a G without having to answer the health questions. So that's really important. If your plan starts to really go up in price and you're not healthy enough to move, like if you were in a blue state, you'd just be stuck there. But if you're in one of these red states, you would be able to move to a similar or lesser benefit plan. So you can move to a G or maybe move to an N. Missouri is a weird state. Missouri is your anniversary state, which means it's on the anniversary of your policy. Whenever you got your policy, they give you a little window around the anniversary versus around your birthday, those other states. So if you're not in one of those red states, you're in a blue state, then the only way you can move typically is if you can answer those health questions. And if your rate starts skyrocketing, you're like, I can't afford a Med Sup anymore. Welcome to everybody else's problem. Everybody feels that way. After 3, 4, 5 years on a Medicare supplement, they're like, I really like the flexibility. Any doctor, any hospital, I like knowing exactly what I pay every month and not those copays, but I can't afford it. So that's where you might need to talk to us, the Medicare family, about your other options in private Medicare, Medicare Advantage, PPOs, HMOs plans. They might be a more affordable option for you when you can no longer hold on to your Med Sup. Now, when you buy a plan, wherever you are, keep in mind, what is your long-term plan? Do you want to stay in that state? Or do you want to retire, snowbird out down to the south, or go move closer to one of your grandkids? Because that's also something to have in mind when you're first going on Medicare and you're trying to figure out what plan to buy. If you don't plan on staying in one of those red states, that should have an impact on your decision. Call us at the Medicare Family. We love what we do. We hope it shows, and we'd love to help you and your family. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.